Welcome to Realizing Resilience, a podcast from the Connecticut Women's Consortium. We're not behavioral health professionals, but we're your gateway to real conversations with the experts. Each episode, we'll delve into the vast landscape of mental health, from personal stories to expert insights. Together, we'll bridge the gap between clinical expertise and personal experiences, connecting with diverse voices and perspectives. Join us for insightful conversations that demystify the world of mental health.
Rich Tirloni is Vice President at Millennium Technology Solutions Incorporated in Prospect, Connecticut. Rich has over 20 years of experience in IT supporting small and medium-sized businesses, many of which are HIPAA-covered entities or business associates. Rich has assisted numerous businesses and organizations to become HIPAA compliant. In addition, Rich is a board member of Guardian Ad Litem Services, a Naugatuck-based nonprofit. Rich works with the executive director and the board president to make sure Guardian is HIPAA compliant every year. Welcome back to Realizing Resilience. My name is Alana.
And I'm Marisa.
And today we have the pleasure of speaking with Rich Tirloni. So thank you so much for joining us today, Rich.
Thanks for the invitation.
So the reason you're here today is you're working with Mike Macniak on an upcoming training that we're offering called HIPAA Understanding and Managing Risk, which covers electronic storage of patient information under HIPAA's security rule. I'm sure most people listening are familiar with HIPAA, but what is the security rule specifically, and what are some things providers can do to ensure that they're compliant?
Sure. So the security rule references the specific portion of HIPAA that applies to electronic protected health information. So it's 2024. I assume anyone listening to a podcast has a computer, and if they use it in their HIPAA regulated business, they're going to be using that computer for health records in some way, shape, or form. I'm sure there's someone out there who's would fall under HIPAA and is still using paper records, but I don't know where they are. So because that computers have infiltrated every aspect of running a modern business, the security rule revolves 100% around that. The crux of it is to protect and safeguard the patient's data. The safeguards can come in a couple different flavors, right? They can be administrative, being a policy, physical being like, a locked door, or technical, which is really kind of my area of expertise, which is, what are you doing to protect your computers and make them safe, and thereby make the patient data or client data safe.
I love when people say flavors instead of options. I do want to put that out there. I think that's a great, because flavors just makes it more fun. So did have to say that.
So the second part of your question was about what people can do to move towards applying the security rule. So if they haven't done anything, then the first thing that they need to do is to start, right? Because as you know, and I'm sure you've heard before, HIPAA doesn't expect perfection, but it does expect you to try. So half of the battle is actually trying. It is actually starting. So if you have HIPAA policies, that's great. If you haven't looked at them, it's January, as we record this, it's January 11th of 2024. If you haven't looked at them last year, well, that's not great, but it's a new year. And with that new year comes new opportunities. So you should look at those policies. And a critical part of the security rule is doing what's called a HIPAA security risk assessment. So that's to find out where your vulnerabilities are, like what you need to work on. What are you doing or not doing to protect that data, and to just make yourself not only just safer in regards to meeting these HIPAA requirements, but just to make your business safer and more secure in general.
I feel like people often think about HIPAA in terms of what they can and can't say to others about their clients or about patients or whatever, but the other aspect of storing that information or having that information, I think often isn't considered as much. So the security aspect is definitely something that maybe not enough people are aware of or as educated in, because like you said, there's probably someone who does paper stuff somewhere. There has to be, considering it's not just the information that you hold in your head or in your notes, but that other information for sure. So what do you see as some of the largest challenges that organizations face when it comes to maintaining HIPAA compliance from more of a cybersecurity lens?
Well, when you look at the security rule, once again, the first thing to do is to start, right? Is to start that security risk assessment. But if you do it, if you're an actual practitioner, if you're not a big enough organization or business to have an internal IT department, it's pretty technical, and it's going to be super intimidating, because it's going to have a bunch of technical jargon in it and ask a bunch of questions that you're probably not going to know the answer to. So at some point, and I know I'm biased with this, you're going to have to ask your IT professional to help. You're going to need some help with that, unless you are a super technical person. I'm sure there are those people out there too, but chances are you're not. So You can try to start it by yourself and then, pull someone in, but it's probably a good idea to just ask whoever does your IT, can you help me with this? Because a lot of the questions, like for my clients, a lot of the questions I can answer them right off the top of my head, or with a minimal amount of like research. Let me, I can create a list of things that I have to check up on. Another critical thing is training, right? And I know that's true of every part of HIPAA. I'm not an expert in the privacy rule. I am a business associate for a lot of my clients, so I do have to do the whole HIPAA compliance thing myself. I don't store data though. Like I don't have any EPHI because we don't actually host any systems for people, but we have access to their systems and sometimes access to their offices. So that's why we're a business associate. But I do have to go through the process myself. I understand how intimidating it can be and how complex it can be. But it's like anything else. If you just start, it's a little bit easier. But the training is critical. Let's assume for a second that you do the security risk assessment and everything's perfect. That would blow me away. I'd be shocked if that was the case. But assuming it's all perfect, you still have to make sure that your users know what they're supposed to do and what they're not supposed to do. They have to understand all the policies that you put in place about the patient's or client's data and what they can or can't do with them. Like they can't, text information to a patient. They can't just email information to a patient. And also, they need to be cognizant of basic cybersecurity, meaning that they shouldn't be clicking on links in emails. They shouldn't be going to websites on their, personal websites on their work computer, things like that. On top of that, there's also a whole bunch of things that as a business owner, you can do to make yourself more secure, getting really good antivirus and watching it. For most people, that means that you're going to have either an IT department that's watching it or like a contractor like myself that's watching it, but enabling multi-factor authentication. So that's like when you go to log into a website, I know everyone runs into this where you get a code texted to you, or ideally you get a notification on your phone that pops up. So you have to enter in that code. That makes your email or your EHR or whatever it is you're logging into infinitely harder to hack. It's annoying, but it's easy. And it makes you so much safer. But there's also aspects of HIPAA that get really technical and really, like, I don't want to say annoying, but they want you to be randomly auditing like access permissions. Like if you have a 10-person office, does Rich, who works Rich in IT probably needs access to a lot, but maybe Rich at the front desk doesn't need to be able to see every aspect of the organization's data. Maybe the actual practitioners only look at their patients or their clients. Maybe that doesn't work for your organization because maybe you're running a bunch of group homes. I have clients who run group homes, right? And maybe I work in one group home A, but sometimes when people are sick or call out of work or on vacation, whatever, I have to cover group home B. So it's practical and reasonable for me to have access to the data related to both group homes, but you're supposed to be randomly like auditing that. You're supposed to be auditing all your logs on all your computer devices. Now, that's something that no one does manually. I can say that with some surety, but there are automations that you can put in place and software that you can buy that will do that for you. I mean, that's what we do. I could never like look at all my clients' logs, but there's processes that you can do to like check off these boxes. And like I said, all this stuff, as intimidating and annoying in some regards as it is, does make you safer as an organization. No one wants to get ransomware. Like we're all in Connecticut. You saw what happened to Prospect, right? To Waterbury Hospital. That was a nightmare for them. No one wants that. 20 years ago when I started in IT, viruses were a nuisance, right? They were the equivalent of you showing up for work and someone having spray painted graffiti on your door. Do you even call the police? It's a crime, right? But do you even call the police? You just paint the door. Now ransomware is extortion. And sometimes it's theft. That's a crime. And that's the kind of crime that you are going to call the police for. And the same thing with just flat out theft. Like someone hacks your system and tries to steal data. They try to steal personal information that they can then sell, on the dark web so that people can try to steal, your patients or your clients' identities. It's the entire internet has changed a lot in the past 20 years. And it is just a very dangerous place these days. So not only does abiding by the security rule make your patient's data safer, it makes your organization, whether it be, whatever it is, whether you're a doctor or a therapist or what have you, or, HIPAA applies to a lot of other businesses. It applies to almost every IT company that supports a covered entity. We're all business associates. A lot of accountants are business associates because they'll do billing. It makes all those businesses safer because these are really things that everyone should be doing anyway. It's just something you need to start. I think starting is the hardest part.
I feel like even in like the past 10 years, the landscape of the internet has changed so much. And I used to work in medical billing. So I was a business associate. I did HIPAA training, and we used to get these emails. It was about 10 years ago. It was like my college summer job. And they would have these crazy scenarios about HIPAA compliance where it was like, you put documents in the dumpster and then a robber robs the dumpster and steals all of the patient information. Whose fault is it? Are you HIPAA compliant if you put paperwork in the dumpster? And like, that's 10 years ago. So thinking about the lengths that someone would have to go through to get that information, whereas now it's like, I'm assuming if an agency is not secure, you probably don't even have to be that good at using a computer to get access to some information.
There's a couple different types of breaches, right? There's accidental breaches. There's malicious breaches where there's actually an employee who's stealing data, right? I think you want to protect, and there's also outsiders who are actually trying to hack in and steal data. You want to protect against all three. The hardest one to protect you is obviously the employee who's malicious. I'd like to think that it's the least common. It's probably not. But let me give you a scenario, right? HIPAA says that all portable devices are supposed to be encrypted. So if an employee has a laptop and it's not encrypted and it's not set up with a password and it has a bunch of PHI on it, the company policy should be that the employee safeguards that laptop whenever it's offsite all the time, meaning that you don't leave it in an unlocked car, you don't leave it at a table at a coffee shop and go to the bathroom. But say someone has it on the passenger seat of their car and they stop and they grab a hot dog at a hot dog cart and someone steals it off the passenger seat. So if you followed all the policies in the security rule, that laptop should be encrypted, it should have a password on it, and it should have some means for you to remotely erase it. So at that point, if you've done all this, you have those policies in place and you're actually doing all that stuff, yes, you've lost the laptop, but you can contact your IT department, tell them we lost this laptop, we need you to remote wipe it. And the next time that laptop touches the internet and is on, it's going to erase itself. So you've had a breach, but it's a minor breach because it's been mitigated. And if for some reason that breach does get elevated to Health and Human Services, is the government entity that oversees HIPAA, the actual office that handles enforcement is called the Office of Civil Rights, the OCR. So if the OCR is investigating this, which is probably very unlikely, but if they were, they would see that you have the policies, the device was encrypted, and you've pushed out a instruction to remote wipe it. So you've done everything you're supposed to do. So I don't even know if there would be a fine associated with that because, once again, HIPAA doesn't expect perfection. The opposite of that would be the computer without the password that's non-encrypted that someone stole. Like, now you have a problem. You have no way to track it. You don't know who took it. You don't know what they've done with it. So now you have a problem. If you don't have policies that your employees are aware of that tell them that they're supposed to be safeguarding it, that they're not supposed to be doing that, well, then that is another layer of a problem on top of this situation, right? Because you're not doing what you're supposed to be doing. So that's the situation you don't want to be in. Not to mention the fact that it's just embarrassing. If you have to send those breach notices, I got a breach notice last week from Yale. So did every member of my family, mind you. Because there was a breach in the spring with this software called Move It, and I don't remember the details to be quite frank, some system that they used this software, and that software was vulnerable and they exfiltrated data. They didn't get like my social security number, but they got my name, my address, and I guess some of my health background. That's the world we live in.
Do you feel like people who have maybe like not high levels of computer literacy or media literacy are more hesitant about doing things around HIPAA? So maybe they'll be less likely to like reach out to someone, or they just kind of like avoid it? Or are you seeing it's just like, if I have less of a computer literacy, I'm going to reach out to someone immediately?
Well, I think that depends on the person, right? I do think people get intimidated by it. They think that they looked into it 3 years ago or 5 years ago, and they put some policies in place that they downloaded and that they're all set. And that they're, I think it's particularly true of small organizations. Like, say you're a 3-person therapist office and you have a receptionist, you're probably not doing everything you should be. But the fact is that everyone's vulnerable. The internet's just a dangerous place. And it's the other thing about the internet that's always very scary is that you can be in a safe place on the internet and the next second you're not in a safe place on the internet. It's not like when you're walking through a city and you slowly see that you're walking into a bad neighborhood. You get instantly transported from the nice part of town to the bad part of town. But those small organizations, I think people are intimidated by technology. Unfortunately, it's just everywhere. It's ubiquitous. So I think everyone needs to do what they, or at least try to do what they can do to keep themselves safe and keep their, keep this protected information safe.
One of the other things too, I feel like not only the landscape of the internet, but just keeping up with regulations changing and amendments to HIPAA. What are ways that people can stay on top of that, and how does that connect?
I use something called the HIPAA E-tool. By the way, it's just something I buy. It's not something that I get anything from, but it's these two attorneys in Missouri, the Haleses, Maggie, and I can't remember her husband's name, but they built this online tool and it walks you through the process. You have to pay for it, but the other thing that comes with that is you get their expertise. When I have a question, I'm like, how does this apply to me? I can send an email or they'll even get on a Zoom and help you out, because it is very technical. And the thing with any of these regulations is, Congress writes the law, the HHS interprets the law, and then you have to make sense of their interpretation and how that applies to you. So, the thing that I like to do is, like, my clients outsource their IT needs to me. I outsource HIPAA to them. Like, I do it, but I'm very knowledgeable about IT. I am not very knowledgeable about HHS's interpretations of HIPAA regulations, because there's just too much there. It's just too much for anyone, quite frankly.
Yeah, that's a lot of information going around all the time. And especially if like you were saying, if you're someone who's intimidated by technology, then having to kind of like interpret these things by yourself can be so daunting.
Yeah, and it's not reasonable to expect someone who's I'm going to go back to a professional therapist, right? Because I think of my therapist all the time. They're a therapist. That's what they do. They're not IT experts. Like, they're not qualified to fill out that security checklist any more than I'm qualified to help someone who's having a breakdown. Like, I should not try to do that. And they probably shouldn't try to do the security rule. So that's why, and along those lines, that's why in order to write HIPAA policies, I use the HIPAA e-tool. Their tool tailors it to my needs or my client's needs. And it just makes the entire process a lot easier when someone's essentially electronically holding your hand through the process. One other thing that I do want to note is that the security rule is all IT focused, right? So if you're an organization and you have an IT person, whether they be in-house or someone, a contractor, vendor like me, just because you've fulfilled all the requirements of the security rule, that still doesn't make you HIPAA compliant, because the security rule is really just supporting the privacy rule, right? It's really just support for that without the privacy rule and all those safeguards, that's really the core of the HIPAA regulations, right? So I do want to say that is that, it's kind of a group effort. I can tell a client what policies they should put in place, but they actually have to put them in place. They actually have to train their staff. I have tools that can help train their staff on the cybersecurity, but the actual training of the HIPAA regulations and all the policies about whether you have like a clean desk policy, meaning that, you don't have 7 patient folders open on your desk all the time where someone walking by can read them, that's outside the scope of IT, but it's critical to HIPAA.
For me, I mean, granted, I'm not in a position where I need to be HIPAA compliant in my job, but just I think even as a person who's, this is a thing that impacts anybody. Like you said, even if you weren't in IT, you were still a victim of the breach. So I think just having an understanding of what pieces are in whose court is really crucial, primarily for the people that we serve, for behavioral health professionals, just knowing how everything connects and like what you can handle and what you can't. It's a little bit more reassuring to know that as long as you're trying, you are not going to like go to jail.
No, you're not going to go to jail as long as you can go to jail, but you'd actually have to be there'd have to be malfeasance involved, right? You'd actually have to be taking that data and like selling it or, doing something horrible, quite frankly, doing something criminal. But the trying is the key. Like, everyone should be trying. That is something that's very important to remember. I know I've said it a dozen times. If you've started, you're already in an infinitely better place.
That's like every tax season being afraid that you're going to go to jail because you're definitely doing something wrong. I don't know what I'm doing here. I don't understand taxes. So I feel like, especially because like the HIPAA compliancy rules and things can be really wordy or worded in a way that not a regular person speaks. you would think like, if I do something wrong, this is it, it's over.
Yeah, and like I said, my area of expertise is specific with security rule and IT, but that is not really the way it works. Like, you shouldn't be scared of it. You certainly shouldn't be scared of doing it, because doing it helps you instantly. Putting some policies in place, talking to your staff about it, is going to put you in an infinitely better place should there be a breach, no matter, big or small. It's going to put you in a much better place.
I think that's a great note to end on.
Yeah, this was a lot of great information, and also kind of made HIPAA seem a little bit more approachable in a way that it was kind of how you had said, like, it doesn't expect perfection, it just expects you to try.
Yeah.
That makes it a lot more approachable, and thinking like, take a deep breath. All you have to do is try and figure it out first.
Ask for help, because everyone's going to need help with this, in my mind. Unless you're literally a HIPAA expert, everyone's going to need help either understanding the law or applying the law or applying the security aspect of the law. Most people are going to need help. So you just have to ask for it.
Thank you so much for talking with us today. This was great.
Thank you so much for the invitation. I appreciate it.
Thank you. Take care.
Links will be in the description to sign up for HIPAA Understanding and Managing Risk on March 28th, and to keep up with us at the Connecticut Women's Consortium. Thank you so much for joining us today, and we will see you next time.